Hello,
Welcome to Demo Go.
your guide to fundamentals of nursing practice.
Let's get started. Here's how it works.
Simple. You just have to select, watch, practice, and repeat. In this video, we will guide you on changing an occupied and an unoccupied bed. Changing an occupied bed? Please review this educational use and supervision disclaimer before using this material. Refer to this academic reference and copyright notice for details regarding sources and usage. Now let's start. Presented here is an overview of the assessment phase, which will show the process that will be followed to evaluate the patient and gather the necessary information before performing the procedure. Now for the implementation phase. Here is an overview which will describe how the procedure will be carried out during the return demonstration. One, explain to the client what you are going to do, why it is necessary, and when you will come back. 2. Wash hands and observe appropriate infection control procedure. 3. Provide for privacy. 4. Remove the top bedding. Check and remove any equipment attached to the bed linen, such as signal light. Leave the top sheet over the client, or replace it with a bath blanket. Loosen all the top linen at the foot of the bed and remove the spread and the blanket. Five, change the bottom sheet. Assist the client to turn on the side facing away from the nurse where clean linen is. Then, loosen the foundation of the linen on the side of the bed near the linen supply. Fanfold the draw sheet and the bottom sheet at the corner of the bed, as close to the client as possible. Place the new bottom sheet on the bed, and vertically fanfold the half to be used on the far side of the bed as close to the client as possible. Tuck the sheet under the head to the edge and miter the corners if a closed bed is required. Place the clean draw sheet on the bed with the centerfold at the center of the bed. Then fanfold the uppermost half vertically at the center of the mattress. Change the pillowcase and place the pillow on the clean side of the bed. Assist the client to roll over toward you into the clean side of the bed. Raise the side rail if available before leaving the side of the bed. Move to the other side of the bed and lower the side rail if available. Remove the used linen and place it in the portable hamper. Unfold the fanfold bottom sheet from the center of the bed. Facing the side of the bed, use both hands to pull the bottom sheet so that it is smooth. And tuck the excess under the side of the mattress. Unfold the draw sheet, fan-fold it at the center of the bed, and pull it tightly with both hands. Tuck the excess draw sheet under the side of the mattress. Six, reposition the client in the center of the bed. 7. Apply or complete the top bedding. Spread the top sheet over the client and either ask the client to hold the top edge of the sheet or tuck it under the shoulders. The sheet should remain over the client when the bath blanket or used sheet is removed. Eight, ensure the continued safety of the client. Raise the side rails if available. Place the bed in the low position before leaving the bedside. Attach the signal cord to the bed linen within the client's reach. Put items used by the client within easy reach. And lastly, 9. Bed making is not normally recorded. Developed under the College of Nursing of the University of Riesel System, Tete, year 2025 to 2026. This video is a collaborative work of the following student researchers, in partial fulfillment of the requirements for nursing research. And that concludes our video. Thank you for watching. Explore more of our videos on the fundamentals of nursing practice on our website.